Hi, and welcome to our presentation. My name is Dina Slanda, and I'm faculty in the Exceptional Student Education Department at the University of Central Florida. And I'm also a project coordinator for the Teacher Quality Partnership Grant at UCF. I'd like to introduce you to my colleagues.
Hello, my name is Leah Herbert. I'm a second-year doctoral student in counselor education at the University of Central Florida, as well as a research associate on the Teacher Quality Partnerships Grant.
Hi, my name is Lindsay Pike. I'm also a graduate research associate on the Teacher Quality Partnerships Grant and a second-year doctoral student in exceptional student education at the University of Central Florida.
And welcome. My name is Mary Little. I'm a professor in exceptional student education at the University of Central Florida and also the director of the Teacher Quality Partnership Grant, as well as several OSEP funded grants. We are thrilled that you are joining us today to talk about some recruiting strategies, retraining strategies for special education teachers.
So we all know that there is a critical shortage of special education teachers. We know that that critical shortage is actually the product of multiple things, right? It could be the product of not being able to attract talent to the field. We know that there's been reduced numbers of teachers entering or reduced number of people seeking opportunities in education. But then we also know within special education that attrition has become a great concern. And that the critical shortage really impacts the delivery of special education services for all of our students with disabilities. Special education teachers, we also know, face greater demands on their time. They have multiple caseloads of students that they have to work with. We know that they have reduced access to very limited, already limited resources due to budget concerns. There's increased paperwork for our special education teachers when compared to our general education teachers, as well as sometimes lack of administrator support because there are so many things that are unique to the special education teachers' roles that sometimes our administrators are not well versed in some of those rules, laws, policies, procedures. And those external demands really weigh heavily and lead to greater levels of teacher attrition and burnout.
When we consider personnel preparation and addressing some of the issues that Dina just reviewed, we as a committee believed it was so important to look at also inclusive preparation for special education teachers within a broader context of education for all children. And so a team of us proposed and was awarded a 5-year Teacher Quality Partnership Grant that is focused on some of our schools in our high needs areas. This is a 5-year project designed to recruit, prepare, and retain the most highly effective teachers with expertise in mathematics, disciplinary literacy, universal design for learning, and culture responsive pedagogy to teach and make a difference for our students with and without disabilities in our high needs schools in our area. Faculty and administrators collaborated and continue to collaborate to develop, implement, and evaluate an enhanced partnership model to address these goals. This comprehensive framework also includes the well-being and mental health for our teacher candidates within this comprehensive structure. As Dina is showing us here, the structure, the synergy really is among the teacher candidates, the teachers in the schools, supervising teachers, the instructional coaches, and the clinical coordinators, which we call professors in residence. Given that the professors in residence are focused and are on site, we really can look at developing a synergy and support for all of the members of these critical components of teacher learning and professional development. Focus specifically on resiliency. Leah, you want to talk to us a little bit about that?
Sure. So in terms of building the mental health capacity, as well as retention and engagement of our pre-service teachers, we turn to evidence-based practices and research. Research has time and time again proven that building the resilient support of pre-service teachers leads to overwhelming benefits in terms of addressing their mental health, emotional well-being, as well as building their internal as well as external resilient support. counseling and wellness. Fortunately, with the Teacher Quality Partnerships Grant, we're really able to do a lot of that resiliency building work by enabling teachers to become flexible when faced with adversity, and as well as promoting professional identity. We also are able to promote teacher wellness, which is such a pivotal and key part of our program. Professional learning for support and training on social emotional learning, social emotional wellness, and care. As a licensed mental health counselor, as well as clinical mental health researcher, I'm able to tap into many capacities as well as evidence-based research and supports to really provide capacity building as well as social emotional development for our pre-service teachers within our program. Supports provided during internship. Fortunately, teachers, interns in TQP are provided an onslaught of supports, both at the cognitive level as well as the behavioral level, and helping them really shine within and outside the classroom. On-site professional learning and coaching are implemented by our professor and residence model, a really innovative, multifaceted mentorship support aspect. Job embedded coaching within the classroom, competencies to develop and sustain culturally responsive pedagogy, especially given in teacher quality partnerships where we are working in high need, diverse, and ever more inclusive demanded schools. Culturally responsive teaching pedagogy supports are also provided for our teachers. Supports for mental health and well-being delivered from Faculty of Counselor Education, which is one of my disciplines, and weekly professional learning communities of interns and supervising teachers and PRIs. We really do a great job of this community building, both within the physical as well as the remote space. Through our social media, we have been able to really enhance this community building and really develop supports outside of the traditional classroom space.
So some outcomes from the counseling and wellness initiatives that we've put in place in our project. The first being retention of project interns in the teaching profession. And so as a result of supporting not only their development as teachers and their content knowledge and skill proficiency, but also investing in them as people and their mental health and wellness needs. So retention has been one of the outcomes that we have been able to achieve through this, especially of note, seeing as they are in high need schools, which increases those demands. So this is going to impact the percentage of highly qualified teachers who teach in high need areas by addressing those needs that relate to wellness and self-care. We're going to increase resiliency, and hopefully that will bring along more highly qualified teachers who are in high need areas and stay in high need areas. And we are also, with our work, putting together a framework for building resiliency. Our hope is that what we have done in our project can be replicated in other places to support these same needs in teacher preparation nationally and maybe even globally. And one of those partnerships is also through the universities that are working with them, creating that partnership between the community school sites and the universities to support the counseling and wellness needs of our pre-service teachers. So our action plan in the TQP project evolved over 3 different phases, and then speaking specifically to how that impacted our priority of implementing wellness strategies and support for our pre-service teachers. So at the onset, as Dr. Little had mentioned before, we felt it very important to bring in experts in the area of wellness and in the area of pre-service teachers and what their needs might be. So working with faculty from the university as well as national partners to develop that framework and work on how we can disseminate that sort of, or disseminate that information and those supports to our pre-service teachers, as well as looking at how do we evaluate if it's working. During phase 2, we continue to support the rollout of this wellness initiative by hosting weekly meetings, continuing to calibrate and recalibrate what we're doing based on the needs of our interns, by connecting them to resources through webinars and professional learning. And then again, really fostering that relationship between our PIRs at our schools and our teacher candidates, and those PIRs being that linchpin role of providing this support. And then as we move into the sustained aspect of our project, is the sustainment phase, we're looking at the fidelity of implementation to ensure that from semester to semester, our interns are getting the same type of support, evaluating the positive outcomes of that, and then looking to, again, enhance and modify what we're doing to always be looking to make it better and improve how we support in this way.
Well, we want to take a minute just to say thank you. Thank you for joining us for our talk today about supporting our special education teachers and how we can help build their resiliency and ensure that they remain in the field. We hope that you continue to follow us.
Thank you. And just as Dr. Slanda had mentioned, following us on TQP Downtown EXP on all social media platforms would be greatly appreciated. We also believe in community building within the digital space. So sharing pictures, insights, and testimonies would be greatly appreciated. And we hope to connect with you in the near future.